Have you ever wondered if your body has been sending little hints about your fertility without you even noticing? Tiny clues that most women brush off as normal, but could actually be pointing to something deeper. Today we're uncovering the surprising fertility signs most women miss, and some of these will genuinely surprise you. Our bodies are incredible storytellers. They whisper, they nudge, and sometimes they practically shout at us. But life is busy. We ignore the headaches, the irregular periods, the weird mood swings, thinking, it's just stress, it'll pass. Yet for anyone who might want children someday, whether soon or years from now, understanding fertility early gives options. It's like learning the rules of a game before you play. Fertility isn't just about pregnancy. It's about hormones, cycles, sleep, digestion, skin, and even mood. Many researchers call menstruation a vital sign, meaning your cycle isn't just a baby-making clock, it's a health report card. If you enjoy learning how to understand your body with simple explanations, make sure to like this video and hit subscribe so you don't miss more health content that supports your wellness journey. Now let's decode the signs your body might be using to communicate. One of the biggest clues many women ignore is irregular periods. A lot of people think irregular cycles are just how their body is. Maybe your period shows up every 25 days one month, then 37 the next. Maybe it skips a month or two. Yes, stress or travel can affect cycles, but when your cycle regularly changes by more than a week, it may mean ovulation isn't happening consistently. Ovulation is the star of fertility. No ovulation means no egg release, and that makes conception harder. But even beyond pregnancy, ovulation helps your body make progesterone, a hormone that affects sleep, bone strength, metabolism, and even mood. So irregular periods aren't just about trying for a baby, they can affect your everyday well-being. Another sign often dismissed is period pain that feels extreme. Many women think painful periods are just something to tough out. But pain that makes you miss work, rely on medication just to get through the day, or pain that spreads into the back and legs can be a sign of something deeper. Some conditions, like endometriosis, go undiagnosed for years because symptoms seem so ordinary. If your period pain feels like it controls you instead of you controlling it, it might be your body communicating something important. A third sign shows up in a place many don't connect to fertility: your sex drive. A low libido is often blamed on stress, exhaustion, or just not being in the mood. And sometimes that's true. But when low desire becomes the norm, lasting months or years, it can reflect imbalanced hormones. Women produce testosterone too, and it plays a big role in libido, muscle strength, energy, and mood. When hormones are out of balance, libido is often the first thing to fade. Another unexpected clue is hair. Excess facial hair on the chin or upper lip, or sudden hair loss on the scalp, can be connected to higher androgen levels. These changes sometimes appear with conditions like PCOS, which affects ovulation. Many women only discover imbalances like this when they experience difficulty getting pregnant, all because hair changes didn't seem important. Skin can be another messenger. Persistent acne, especially along the chin and jawline, can reflect hormonal shifts. Breakouts happen to everyone, but painful cystic acne in the same areas month after month often points toward hormonal patterns rather than random skin irritation. Weight changes can also be a subtle sign. If you're gaining weight, especially around the midsection, without changing how much you eat, hormones might be influencing how your body stores fat. Even stress hormones can play a role. Chronic stress can disrupt reproductive hormone signals, not because stress causes infertility, but because it influences hormones that affect ovulation, thyroid balance, and insulin sensitivity. Another sign women commonly overlook is chronic fatigue. If you feel exhausted no matter how much you sleep, it may relate to thyroid function or iron levels, both of which support reproductive health. The thyroid impacts metabolism, mood, and menstrual cycles. Fatigue alone doesn't mean anything is wrong, but when combined with other signs like irregular cycles or hair changes, it becomes information worth noticing. The amount of bleeding during your period can also tell a story. Very light periods may reflect low estrogen or a thinner uterine lining. Very heavy periods may relate to imbalances where estrogen dominates over progesterone. The flow itself becomes part of the puzzle. Another sign many women quietly endure is pain during intercourse. Many feel embarrassed to talk about it or believe that discomfort is normal. But pain isn't something to push through. It may relate to stress, tension, hormonal dryness, or deeper conditions like endometriosis. Pain is information, not something to ignore. None of these signs mean something is wrong. They are pieces of a picture. Awareness is power. Rather than labeling symptoms as normal or abnormal, the key is simply noticing patterns. One of the simplest ways to support your fertility health is to track your cycle. You don't need anything fancy. Just note when your period starts, how long it lasts, the flow, mood changes, headaches, cravings, or pain. Over time, patterns reveal themselves. You become a scientist of your own body. Another powerful habit is prioritizing sleep. Hormones regulate themselves during deep sleep. Supporting sleep is one of the most effective ways to support long-term hormonal balance. Rest isn't lazy, it's necessary biology. Stress management matters, but not through perfection. You don't need to meditate for an hour or escape to a spa. Small habits like slow walks, stretching, quiet moments alone, journaling, or even breathing deeply can help calm stress signals that affect reproductive hormones. Nutrition supports hormone health too, not through restriction, but through consistency. Balanced meals help stabilize blood sugar, and that supports hormonal regulation. Above all, listen to discomfort instead of normalizing it. If something feels off, your body isn't complaining, it's communicating. Rather than trying to self-diagnose, simply observe patterns. Awareness helps you make informed choices if you ever need guidance. Your fertility is not defined by age alone, and it's not defined by whether you want children. It reflects your overall health, your hormones, your stress, your sleep, and your emotional well-being. The more you understand it, the more power you have in your decisions. Your body is always talking. The question is, are we listening? If you found value in understanding these hidden signs, like this video and subscribe for more content that helps you learn about your body in a simple, empowering way. Share this with someone who deserves to understand their body better, and above all, take care of yourself with kindness.